Hello and welcome to Medical Dialogues. I'm Anshika Mishra. As what I bring to you from the world of medicine. Dried fruit consumption linked to lower risk of type 2 diabetes according to a study. In a recent study published in the journal Nutrition and Metabolism, researchers evaluated the causal effect of dried fruit intake on type 2 diabetes. Dried fruits have become popular among people seeking healthier alternatives to snacks. However, concerns regarding its sugar content have emerged regarding type 2 diabetes. Type 2 diabetes represents a significant public health challenge due to its association with complications such as nerve damage, cardiovascular disease, and kidney dysfunction. Dried fruits contain essential nutrients such as fiber, vitamin, and mineral, enriching a balanced diet. However, sugars in dried fruits are rapidly released into the bloodstream, causing spikes in the postprandial glycemia, which could be challenging for those striving to stabilize glucose levels. However, there has been a shift in this perspective, with dried fruits now being recognized for their fiber level, micronutrients, and minimal fat content related to their fresh counterparts. Animal studies and randomized control trials have suggested the potential benefit of dried fruit in cardiovascular disease.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
In the study, researchers explored the potential causal link between dried fruit consumption and type 2 diabetes using a method called the Mendelian randomization. They used genetic data from a large UK biobank study involving over 500,000 participants who provided information through questionnaires and measurements. The frequency of dried fruit intake was recorded, and type 2 diabetes data came from a genetic study with over 61,700 cases and 5,93,952 controls. The team identified specific genetic markers associated with dried fruit consumption. They use these markers to analyze the causal effect of dried fruit intake on type 2 diabetes risk, employing the inverse variation weighted method. Additional methods like the weighted median and the MR-EGR were used to support the finding. The researchers found that 43 genetic markers linked to dried fruit intake and selected 36 as instrumental variables, excluding those linked to other factors. The study revealed a causal relationship between higher dried fruit intake and lower risk of type 2 diabetes. Specifically, increasing dried food intake by 1 standard deviation was linked to 61% reduction in type 2 diabetes risk. Dried fruits also contain substantial level of beta-carotene, which is protective against type 2 diabetes development. They also contain diverse flavonoids associated with improved glucose metabolism and insulin sensitivity. The findings highlighted that dried fruit intake was associated with reduced type 2 diabetes risk. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.